this is a very complex and complicated problem set that we're dealing with. And one thing no one really talks about in the context of vaccines and social distancing and mask wearing is the other work that your team is doing on the behavioral health side of things and what the stress of COVID-19 is doing to our force. Can you just talk about some of those initiatives?
Yeah, I'll be happy to. The other thing I think we struggle with right now is the constant change, right? Early on, no one wears mask, everyone wears mask. Early on, it was 3 feet, then it was 6 feet, and then it's double masking and it's triple masking. And it's not that the science is changing. What actually is, we're actually learning the science because it's such an unknown environment. Whenever you go into an environment that's that changing and that rapid, and you can't necessarily completely trust that what you heard yesterday is still true tomorrow, it's not that it was a lie before, it was just an unknown. That just adds a layer of stress into your life. And what we do here at the RARE is put a lot of effort into the Behavioral Health Association with this, you know, where leaders can engage. Those leaders that are engaged, that are empathetic, that are out there with the troops, that are wearing the masks, they're setting the examples. Those are the units that seem to be weathering this the best. The units that aren't engaged, where there's still not a group cohesion, they're not engaging through Teams or Zooms or whatever virtual means they can, they're the groups that are struggling a little bit better. And I think all of us, you know, we're coming out of the winter season, always, you know, people are a little more down in the winter season, we're gonna be going to the spring, there's more sun. But with that, there's more vaccines, you know, everyone is looking at it as a positive effort, but it really is a behavioral health drain on us all. And a lot of that's leaders, and it's really just buddy care, right? Look out for each other. And, you know, those that are down, pick them up, move them in the right direction, and keep going. Well,
thank you. I am better for having come up here and seen firsthand what you and your team are doing. You're an infectious disease physician expert, and you're leading the team in this fight. And there's a lot of speculation about the science, and so I wanted to come up here and understand more about the science so that the operations across the region would be well nested and well informed by what your folks are doing. And so I really appreciate your time and you sharing your expertise with us.
Well, thank you. I appreciate it. And really great team effort. You know, we have research across many of your facilities and your locations, and without that relationship, we wouldn't be able to get as much done and as quickly as we've been able to do in the middle of the pandemic. So it really is a team fight, and thank you for all the support.
Great. Thank you.
Thank you.